Hello, everyone. My name is Dr. John Allison. I am a cardiac electrophysiologist in Austin, Texas, and today we're going to talk about atrial fibrillation, or AFib. So, first, what is a cardiac electrophysiologist? So, I'm a heart rhythm doctor. I'm a cardiologist that specializes in the prevention, diagnosis, and treatment of heart rhythm disorders, and that includes atrial fibrillation, or AFib. So, the first thing we should talk about is what is AFib? And for that, we need to start with what is the anatomy of the heart. So the heart has four chambers, two in the top and two in the bottom. The top 8 chambers are called the atrium, and the bottom chambers are called the ventricles. The atrium are the receiving chambers of the blood. They receive blood from the body, where it empties into the ventricles, and then the ventricles pump the blood out of the body to where it needs to go. The ventricles is what we feel as the heartbeat. The ventricles have most of the muscle, and so when they squeeze, that's how we feel a pulse or a heartbeat. Normally, when a normal heart rhythm, an electrical impulse starts in the top chambers, gives you a nice squeeze. That electrical signal will travel down to the bottom chambers to tell it to squeeze, and you get this very nice organized rhythm. In atrial fibrillation, the top chambers do not have that nice organized squeeze. Instead, they're in a very disorganized rhythm called atrial fibrillation, where they're just fibrillating. All of those signals are trying to get down to the bottom of the chambers of the heart, the ventricles, but not all of them can, and it becomes very irregular. And it's a very irregular pulse. It can be fast, it can be slow, or it can be a normal rate, but it's going to be irregular. AFib is the most common heart rhythm disorder in the United States. It affects 1 to 2% of the global population, and about 5 to 10% of Americans over 65 have it. The numbers are increasing rapidly due to the accumulation of risk factors that we're about to discuss. These risk factors include getting older, being a man, having heart disease like high blood pressure, diabetes, or coronary disease, being overweight, or having sleep apnea. But some people just have AFib. They don't have any known cause. We call this lone atrial fibrillation. And there can be, genetics can play a role. What causes AFib? It's not the same for everyone. We do know that all arrhythmias require two things. They require triggers and substrates. Triggers are electrical triggers that set AFib off, and a substrate is a place for that rhythm to live so that it can perpetuate. Some people might be born with the correct combination of trigger and substrate. Some people acquire these triggers and substrates with age and other cardiac diseases. Sometimes certain behaviors or conditions can increase these triggers and substrates as well. These behaviors might be alcohol, coffee, physical and emotional stress, or severe illnesses like an infection or thyroid imbalance. Is AFib an emergency? Not necessarily. Some people might not feel their AFib. It might be completely asymptomatic and their heart rate might be within the normal range. In this case, it is not immediately necessary that they seek urgent medical care. Some people, however, might be exquisitely sensitive to their atrial fibrillation. They might be having chest pain, shortness of breath. Their heart rate may be way over what is normal, and they very well might need to seek medical attention. What might AFib feel like if you have it? It can feel like a rapid or irregular heartbeat or palpitations. It can feel like chest pain, cause shortness of breath, cause lightheadedness. It could cause vague fatigue. It could be asymptomatic. You may have no symptoms. And it could be paroxysmal, meaning that it comes and it goes on its own, or it could be persistent, where it lasts for a very long time without stopping. How is atrial fibrillation diagnosed? You might be symptomatic and seek medical care. Go to the ER or see your primary care doctor. It might be discovered incidentally during a screening test or physical exam, like going to your primary care doctor or having a colonoscopy. You might have a stroke and go to the hospital and find that you have AFib that way, which we'll talk about in a second. Or more commonly, as Apple Watches and other wearable devices are becoming very common, is that people are detecting their own atrial fibrillation. Apple Watch is a very common way, or a wearable patch monitor that can be prescribed by your doctor can also be used to detect atrial fibrillation. What does it mean to have AFib? So first, I do say that there is no cure. We treat it like we can treat diabetes and high blood pressure. We can suppress it, but it's very hard to get rid of forever. Treatments aim at suppressing AFib and controlling their symptoms. And it is a progressive process, so it does tend to get worse with time. The earlier it is treated, the less likely it is to progress. But the longer it is untreated, the harder it is to treat later on. Untreated AFib does increase the risk of stroke and other heart disease in the future. What can you do for AFib? Live a healthy lifestyle is key. Eat a heart-healthy diet. Do 30 minutes of moderate exercise 3 to 4 times a week. Use alcohol and caffeine in moderation. You can also treat your risk factors. Keep your blood pressure and diabetes under control. Maintain a healthy weight. And treat sleep apnea if you have it. You can also keep your thyroid levels normal if you have any thyroid dysfunction. So the next thing we want to talk about is stroke prevention and AFib. So one of the biggest problems with AFib is it does increase your risk for strokes. And the reason is because there's this pouch in the left atrium called the left atrial appendage. When someone has AFib and the atrium doesn't have that good organized squeeze and it's fibrillating, then blood can pool in the appendage and create a blood clot. That blood clot can then break off, go to the brain, and cause a stroke, which unfortunately is how some people are found to have AFib. So many people with atrial fibrillation are on stroke prevention medicines called blood thinners or anticoagulants. Someone's risk of stroke in AFib is determined by what we call the CHADS-VASc score. And this takes stroke risk factors into account to determine whether someone needs to be on a blood thinner or some other form of stroke prevention. And it takes into account age, heart disease like diabetes, high blood pressure, coronary disease, heart failure, or other vascular disease, having had a prior stroke, and others. There are several different blood thinners or anticoagulants we can use. The oldest blood thinner we have is warfarin or Coumadin. It's very rarely used anymore because of the newer options that are available. The advantage to warfarin is that it's cheap. The disadvantage is that it requires regular monitoring of levels. It has significant interactions with diet and other medicines, but it is the only choice in people that have mechanical or prosthetic valves. I'm sorry, just mechanical valves. The other class of anticoagulants is called direct oral anticoagulants. These medicines have been on the market for about 15 or 20 years. They're very easy to take. They don't need to be monitored. They have very little interaction with diet and other medications. However, they can be expensive depending on insurance, and they can't be used in people with mechanical heart valves. Another option for stroke prevention is a procedure called left atrial appendage occlusion. Some people just can't take blood thinners for various reasons. Perhaps they're very unsteady on their feet due to knee problems or coordination issues, and they have frequent falls and they're at risk for hitting their head, which can be very dangerous in someone on a blood thinner. Perhaps they're at high risk for bleeding due to stomach ulcers or other intestinal issues. Or perhaps they have a lifestyle that does not accommodate being on a blood thinner. They could be a professional lumberjack or a professional skier. For these people, a left atrial appendage occlusion device might be a good option. The idea is that with a minimally invasive procedure, a plug can be placed into the appendage and seal off that pouch so that blood clots can't form and break off and go to the brain. People that have a left atrial occlusion device in place do not need to be on a blood thinner for the rest of their life. And I'm actually going to be giving a talk later with more detail about stroke prevention and atrial fibrillation. So how do we treat the rhythm of atrial fibrillation? There are 3 options. One is monitoring or rate control. So this is for people who have very rare symptoms. They're not particularly symptomatic when they have AFib. It does not drastically affect their quality of life, and they don't have any other significant cardiac disease. It might also be a good option for people who wouldn't be able to tolerate treatment of their atrial fibrillation. Either their AFib is too advanced or they're too frail to undergo any new medicines or procedures. We can also try and suppress the rhythm of atrial fibrillation and try and maintain a normal rhythm. This can be done with either medicines or procedures. The medicines are called antiarrhythmic medications. There's several that we can use, and each has its various advantages and disadvantages. Some patients, for various reasons, can't take certain ones, and so we have to try the other ones. They usually work modestly well, although they do have some side effects associated with them. The other potential option for treatment of the rhythm of atrial fibrillation is a procedure called a catheter ablation. And this is a minimally invasive procedure using heat or cold energy to purposely damage heart tissue and alter the triggers and substrates of AFib in order to prevent recurrences. This procedure is going to be discovered in more detail at a later talk by one of my partners. So in summary, atrial fibrillation is the most common heart rhythm disorder in the United States. Atrial fibrillation is a leading cause of stroke, and early diagnosis and treatment is key to preventing strokes caused by AFib. Early treatment of atrial fibrillation can prevent progression, reduce subsequent cardiovascular disease, and improve quality of life. And treatment can include monitoring, medications, or procedures like catheter ablation. Here are some potential resources. So there are a few websites that offer more information about what atrial fibrillation might mean for a patient, or other patient resources to give more details about atrial fibrillation. And there's also my contact information if you have any questions about AFib, whether you have it or think you have it. So I want to thank everyone for joining the session. Once again, my name is Dr. John Allison. If you have any questions, please send them to Cardiovisual through Instagram, and we will try to get them answered as soon as we can.